and Rani Bank, which have shown that working with community health workers and working with the daily regular lives of women, looking at women's empowerment has turned the clock around. I think that is something that needs to be looked at even with government programs to have a holistic approach to the problem. I think that would help, and then infrastructural access to the facilities available and quality of care then come within that particular continuum. So that's the large
We'll
issue.
definitely try and get Mr. Hota's reaction on this, but only after this short break. So people do come back, as there's a lot more coming up on the other side. Welcome back. This is Gender Discourse, and today we are talking about maternal mortality as we are trying to analyze the report of the mothers, of the state of the mothers. Well, before the break, Vijay Lakshmi did mention what the role of the government should be and how the government should look at everything and have a very holistic approach regarding it. So I would like the former health secretary to really respond to that.
Ma'am, as I said, we have to attempt the whole motherhood issue from the medical point of view through a hierarchy of care.
Right.
We cannot go on talking about social determinants, women's education, and absorb ourselves of our responsibility. So the health, personal health ministry, health connected people have to realize so many doctors are not available. Forget gynecologists. MBBS doctors are also not available. Then nurses are also not available.
Yes.
But gynecologists are available for critical care if we can organize them and give them the necessary anesthetic, blood bank and other support. Similarly, MBBS doctors have to be multi-skilled and they have to be empowered. I am sorry to mention this point in presence of a specialist. The more the specialization, the less seems to be the empowering of the MBBS doctors and nurses sometimes, unwittingly. Like laparoscope comes for, let's say, the morbidity which Dr. Nanda was referring to. Then laparoscopic surgeon is a specialist. So all the MBBS doctors tie their hands and wait. So service delivery points come down. But the fact is, holistic view will in the service delivery would be organizing a hierarchy of cares, and our single doctor PSCs are really a waste of medical personnel. There the nurse should be in charge.
Right.
Ayurvedic doctors also should be tried. The doctors should be congregated at block level, and the specialists should be congregated at sub-divisional hospital and district hospital level, and the tertiary care. The present health secretary, Sujata ji, is attempting this. That Janan Suraksha Yojana has thrown up a huge demand without quality. So how do we, in each district today, ma'am, there are not more than 3 to 4 functional institutions for 15 lakhs, 20 lakhs population. First is to double those numbers instead of talking all this again and again and again.
Right.
I would request advocacy group to look at operational issues, not really repeat that these are the global numbers, these are the global practices.
Right.
Pardon my saying, there is a slight amount of health colonialism still persisting in the country. Our willingness to look at others, outsiders, and quote those names instead of seeing our resources
Passing the
and
buck,
optimizing it.
Yes.
While we must benefit from best practices, but we must tighten our own belt and take the responsibility.
Right. Well, at this point, we'll have to bring in Geeta, who's from Tamil Nadu. So, Geeta, if you can hear me, what is it you have in your mind? Geeta, are you with me? Well,
I'm being utilized by the lady. Hello?
Yes, please go ahead.
Yeah, and most of the times it's used by her husband and her in-laws for other purposes rather than her nutrition or for her delivery.
Right.
And what I feel is at the primary health center level, the infrastructure has to be improved a little bit. And what they do is they refer at the last minute. Most of the times they keep the patient there for a long time and they refer the patient to the tertiary center at a later stage where we cannot do anything. So this can be avoided by the higher centers, what I feel.
Okay, thank you so much, Geeta, for that comment. But I like Vijay to really react to that.
Partly, probably she is right, but I don't think that is actually happening so often. What happened, I think I agree with Mr. Hota, because those primary centers are not fully equipped when you think in terms of operational and the logistics which are. So you probably claim that we have opened 10 hospitals all over Delhi, or 12 or whatever number, but then they are not functional in the sense that you post a gynecologist, an anesthetist, then there is no blood bank.
Right.
Or you post anesthetist, there is no gynecologist. So all of us have to work in group.
Right.
We need to have, for a good antenatal and intrapartum and postnatal care, we need a gynecologist. It can be an MBBS level doctor, at least for normal deliveries. Leave aside the surgery part of it. But we need to have a blood bank facility, or at the most the nearest the communications have to be there. As I told you, the leading cause of mortality is hemorrhage.
Yes.
So we have to really equip these hospitals rather than talk of figures. If we have 10 hospitals as of today, and if they are fully functional, at least the urban slums and everything will be taken care of, because they will go to the nearer hospital. They will need not then go to a hospital like, say, Lady Harding or Maulana Azad or Safdarjung, because there are so many other hospitals.
Right.
This is the main problem issue which we are facing.
No,
right
it is very right to say that, okay, we desire to do this and this should happen and that should happen. But I think we also need to look at the big lacuna that is caused by, the exodus of the nurses or even the MBBS doctors. So, Renu, do you think that also somewhere needs to be looked at? When we train nurses here, they work for a year or two and they all want to push off. And even the doctors in that matter. So, when we don't have the right talent here, who's actually going to look after these women?
Of course, I think it's all a question of, we have to make sure that we are training sufficient doctors and most importantly retaining them. I mean, right down, and I would go down the line, and like, Mr. Hota said that this is a continuum of care. Right from, look at what ASHA workers are paid, for example. Only incentives, they're not given a salary. Anganwadi workers are given 1,500 rupees. Look at the way we are actually looking at our healthcare workers, and doctors across the board are, are not willing to go into rural areas often. So, there are many issues here. We've got to, and I know now the government is trying to have special MBBS doctors trained for rural, for the rural areas. The question is, how quickly are we going to act? How quickly are we going to ensure, like, we've heard before from the other panelists, operationalizing and making sure there is quality care, because it's not just about rolling out schemes. I think the question is about governance. It's about making sure we have the right personnel, and most importantly, are they trained sufficiently? So if we are taking community health workers or ANMs or Anganwadi workers, I'm talking of the lowest rung because they're the ones who are in contact with the larger populations, they're the ones who are there, to every day look at the issues on the ground. Have we trained them sufficiently? And I'm again going to say, I think we have very good practices within the country as well, like we talked about Dr. Abhay Bhang, Gadchiroli experiment, which has been quoted in the Lancet as well, and they're one of our partners in Save the Children. How do we make sure that these are replicated? Because when we do have some best practices, we have to bring them to scale. We have to learn from these.
That's right.
And there is talent in the country. How can we make sure that we're looking at governance issues? Because health is a state subject. How are we going to roll this out in the EAG states particularly?
Right. Renu, I'll have to interrupt you here for a moment as we are joined by Vivek again from Maharashtra. So Vivek, this time if you can hear me, tell me, what is it? Vivek, are you there with me? Well, so Bijay Lakshmi, I'd like your reaction here. Now, she very rightly said that everything is there. Maybe even at times the infrastructure is there, but things are not really happening. So do you think that there is a major requirement of a monitoring authority or some mechanism like that which actually goes down to check whether all this is being achieved or not?
I think the government is already looking at some sort of a monitoring system. There is also something called a tracking of pregnancies that is happening, that one is looking at when one is looking at government documents. But yes, I think there's also a need for a community-based kind of, watching and supervision. There's also a need for a training of the community level health workers. The ASHA, who's the accredited social health activist, is paid nothing. The only motivation for working there is the incentive of getting a woman for a delivery. That is not enough. So the need to train and also to give them enough kind of financial motivation to work at the ground level. They could probably change a lot of things at the ground